Welcome. My name is Jerry White, and in my capacity today, I'm coming to you as a retired research physical therapist working in pediatrics with little kids. And we're going to have a dialogue back and forth with several people who work with kids in various ways. We have parents, grandparents, we have specialists, we have people who have been involved with just working with kids in many different ways. And I know that many of you came to hear about a subject that has been concerning us about our kids, called autism. We will be relating to some professionals who work in that arena and some observations. This is is going to be like a mini think tank where we take some ideas and we pour them on the table and we begin to start to work together. It'll be fairly quick as we walk our way through it. And we're going to be talking about the fact that our healthcare system is really struggling to try to keep up with a lot of different disorders that are showing up in our world. This just happens to be one of them. And we're going to be looking at this from the standpoint of, yes, some of us have some professional credentials that have worked in these areas, and we're going to talk about a new set of technologies that seem to have gathered our interest. We're going to open up the door a little bit. This is not to be shared on media or that sort of thing. It's a gathering of people with an interest in helping our families and helping other families and in helping the system work better. We will be talking about the fact that let's let the healthcare professionals do their healthcare professional thing. But what we can do is we can develop ways to look at the environments of our own lives and of our houses and of our children, and what happens when we start to improve our environments on many different levels. We'll be talking a little bit about science tonight. We'll be talking a little bit about personal experience and some conjecture, some of us from our professional standpoints. And we'll be referring to as you go along, you'll hear us talk about REDOX signaling. It's a new science that many of you are familiar with, at least peripherally, and how that affects the environment and how we interact with our environment. You will be on this journey as discoverers, and you'll put together pieces that some of us never get a chance to put together. It's been said that none of us are as smart as all of us. And so as we walk through this study of what's going to be the most beneficial life for all of us in the future, and particularly our little kiddos, what are some of the things that we can be cognizant of, be aware of, and make better? Then from there, we share it with other people, and our world could be better. So I'm going to open up this discussion with what is becoming someone I just have so much incredible respect for, is Dr. Janet Lintala, who is going to help us. So Janet, you can go ahead and click on your screen there. And let's start a little dialogue about your journey in moving toward your areas of expertise. And so as I have it here, that you literally have written books about the subject of autism. So yet you have had some family experiences, but you also have clinical experiences. And so let's just go a little bit over how that journey led you to this discovery of REDOX and why that scientifically was interesting to you in your capacity. You're on mute right now, so go ahead and hit that mute button.
All right. I've been an autism mom for over 24 years now, and I graduated from chiropractic college 1 month before I gave birth to the first of my 3 sons. Only one is on the spectrum, but the day you bring your baby home from the hospital, you don't know it yet, but you're already an autism parent, and you're kind of learning your way with babies and new at the whole parenting thing. Well, our son was different from the get-go, and it was not things that you would associate with autism, especially back in the mid-90s when not a lot was known about it. We knew we had a baby. My husband's a medical doctor, so we both had a lot of, healthcare training. We had a baby who did not sleep, maybe 20 to 30 minutes out of every 90 minutes around the clock, 24 hours a day, 7 days a week. So there was a lot of exhaustion. That's really hard on the family dynamic, to be so tired. He had a lot of gastrointestinal issues. He was, he couldn't walk or anything yet, but he was just hyper. He was always moving and always kicking, and he could never sit still. As he got older, which I'll show in my PowerPoint slides, he became very irritable around the age of 2 or 3. Still not sleeping, but angry. He would wake up angry. Still with the GI issues, the diarrhea and the constipation and things like that. As he became a 6 and 7-year-old, he became quite destructive around the house. Still a very loving, intelligent child. I don't believe in bad children, but very unhappy child, very unhappy family dynamic. By that time, we had 3 boys running around. I was totally outnumbered. And, I just wanted him to have a good childhood and to be able to sleep and learn and play like everyone else. And so by the time he was 7, we finally figured out he was on, the autism spectrum. And he wasn't typical. I mean, he came out talking. Language was a gift. He didn't rock and flap. So we didn't have all those clues. And so I was always seeking, my career, I didn't practice for 14 years. And I was going to conferences. We were seeking out the top doctors in the nation, just looking for ways to help him be more balanced and to have a good day and be like the other kids. And so that's how I really started with the things that I do in my clinic. By the time I wrote my book, I had not come across redox molecules yet, so that's not in my book. But I've never finished learning. I'm always seeking for ways to bring balance and support to these invisible medical issues on the autism spectrum. And so I've been dabbling, with the redox molecules for about 2 years, and happy to include it in my practice. So that's sort of a snapshot of my journey, Jerry, if that's what you were asking.
Very good. Now I'm going to go ahead and have Lonnie go ahead and come on live with us. And this is Lonnie Guerrero. He's the owner of Texas Scripts Pharmacy and been a pharmacist for 22 years. And Lonnie, I'd like to have you give us your perspective on how a medical side might deal with kids. What are they asking for? What are they trying to achieve from your standpoint as a pharmacist?
Well, from my standpoint, a lot of questions get asked to us about the medications, the 2 groups of antipsychotics and antidepressants. So what I usually do when I talk to the parents either beforehand, before they talk to the doctor, I let them know what drugs, the side effects that they can have, and the possibility that it can be used for. But I do let them know, let the physician know everything that's going on with his child, all the supplements that you're trying to do, all the changes you're trying to do, whether it's food or incorporating vitamins and minerals. That's what I do if I can reach the parent beforehand, reach the doctor. If they see the doctor and they get a medication on one of those 2 type of groups, I do let the parents know to look at what side effects are for the child. Because again, some parents, they think that just because they get the pill, maybe it's going to help out the child, I guess maybe get better or see a lot of changes right away. So I do warn the patients, the patients that the medication may help out or it may not. So they have to look for those differences on their child. And again, some children, cannot really speak or be verbal. So they have to look for signs and symptoms like, the external to see how they're acting or how they're being, maybe the twitches of the eyes, or maybe they're trying to communicate with their body language. So when that happens, I do let them know they need to also call the doctor right away. And again, that medication might not be working for them. So we ask them to just, not stop it completely, because these medications do have a side effect if we do stop it cold turkey. So again, there's a process that we let them know on how to titrate down. But also what I do on both ends, I do let them know about, at the same time, they have to incorporate natural medications or natural substances to kind of help out the body. Because again, not just these pills cannot just totally fix it. And that's what a lot of parents nowadays are looking for, that one pill to kind of fix their child. But again, it's a whole process of working again with the doctor, if they're doing speech therapy or PT or OT. And again, a lot of them, we talk to them about fixing the inside. Like she was talking about the gut issues. Are they going to the bathroom on time? How does it look? Are they having the signs and symptoms of a normal digestion tract? If not, then again, they have to incorporate vitamin minerals or like probiotics.
So Lonnie, it sounds to me like there's a real focus on trying to normalize gut issues, and that's going to come up a couple of times through this. Do you have a sequence from a medical standpoint that you like to look at? And we're just going to talk kids in general here, that have these issues. Does that seem to be one of the main issues that they're asking for pharmacology for, or the gut issues?
No, not. I would say like 90% of the parents don't know about that. So I have to like educate and talk to them about that, because again, their diets are very different from other people. Again, they maybe like one or two foods or one or two drinks, and that's what they focus on. But I do educate the parents how important digestive tract is, whether to get like an digestive enzyme to help them out, or a probiotic. So when I give them the whole spectrum of how they work, then a lot of parents will will go that route and take it from there.
And then you mentioned two other drugs in the outset that you'll use as the antipsychotics. And so are there specific things that you take extra care in helping a family know how to use those?
Yes, it's very important. A lot of people do not really, I guess, look at the side effects. But if you see something that's not normal in your child, you need to call the pharmacist right away. And then that's our job to kind of let them know, these are side effects that either they could be seen, and we as a pharmacist should be letting the patient know. That we'll call the doctor right away, and also let the parent know to call the doctors. We can either get a change of therapy, and also wean them off, or let them know how we got to take care of the child, because again, that's our job, is to look out for the patient safety foremost, because some of these medications do have severe side effects, and that's what we want to prevent.
And how do you feel it's going right now with the kids that use these? Are you having pretty good success across the board, or is that even in your wheelhouse? Do you get to see the results?
No, I do see some of the results because of the change in medication. So most of the parents that I deal with, they do listen, and so again, we try to find a medication that's going to help out the child, because again, there's in that category of drugs, there's like 5 or 6, so you can't say this one drug is going to help every single child. It's kind of a hit or miss. So I tell the parents that you got to get at least like 2 to 3 weeks to see it. If not, call us. Do not wait for the month or the 3-month day supply. You know what I mean? So
okay, Lonnie, now are there any things that you would like to tell people about kids in this category, and then we'll move to our next speaker.
I would like to say, like, if you have questions, whether it's anything that's over the counter, like vitamins or supplements or minerals, or the medication you receive, do not leave the pharmacy without speaking to the pharmacist and getting to know the pharmacist, because that's very important, because we are there for the safety. And again, we are the gateway also to the doctors, that prescribe the medications. Because sometimes the patients can call the doctor's office and they can't get through, but we can. So that's what you need to talk to the pharmacist. And if the pharmacist does not give you the time to speak with them, then you need to find a pharmacist that actually does take the time, because that is our job to do.
Super. Thank you so much. Thank you, Lonnie. And you can go back to black there. What we wanted to do is to let you know that this is a very serious part of some people's life experience, and they need the medical community, and they need physicians, and they need the pharmacists, and it's something that we don't take lightly. If those are needs for your family, I love it that you go back and keep checking with those professionals in those areas. I'm going to bounce back to Dr. Lintela for just a second. And when we talk about your son coming home, one of the first things that you saw changes with was changing the gut. And so through that process, can you lay out some things that you developed as a best home scenario, if you will, and a way to sort of develop a plan for somebody who's saying, okay, let's do what we can from here, and then how did that work for you and your family?
Well, people get on the internet a lot and they never know which order to start things in. So let me assure everybody I've made all the mistakes for you already. So like I say, we did go to top doctors across the nation. I did go to conferences and trainings and things like that. And where I am now is I always start with the gut. Lonnie said some really good things. 50% of the kids don't make enough digestive enzymes, so we get that gut dysfunction. They don't have enough beneficial bacteria. They're prone to infections. The gut contains the bulk of the immune system. There's immune dysfunction on the spectrum. And so if you get the gut balanced, a lot of times the immune system will settle down quite a bit. They're usually more prone to colds, allergies, asthma, and we see that settle down after a couple years. I don't claim to treat the immune system, but by supporting the gut, you can affect balance in the immune system. They have a lot of acid reflux, and that drives horrible sleep disruptions and all that exhaustion, in the families and the kids on the spectrum. And if you get the gut properly supported, and that acid reflux might respond by calming down, we see sleep patterns balance out. Hey, now the kid's refreshed and ready to learn at school. It can help attention and learning. There are things that go on in the gut that affect their language centers. And so whether they seem to have gut issues or not, I look under that rock and I start by trying to support proper gastrointestinal function. And that's just where I start these days, whether people have the symptoms or not. And then we see a lot of things shake out of the picture. We just go, let's see what the body will do with this. Let's see how the body handles being properly supported and see what declutters and falls out of the picture. And then we'll come back, have another visit, and make another plan. And that's usually when prescriptions become more important to me. I don't like to see, I'm with Lonnie, I agree. They're giving them antipsychotics for these difficult behaviors, but proper gut support, usually we can get those behaviors to drop out of the picture, and they aren't truly psychotic. Now, there are more psychiatric illnesses on the autism spectrum. So after all this has been properly supported, it might become very apparent someone does need an antipsychotic, but they rarely need the laxatives and the sleeping pills and the things like that I usually see them on. With the exception of the laxatives that they're commonly put on, a lot of the drugs seem to have a side effect of constipation. And when you get polypharmacy or a child or adult being on lots of these medications, they're already struggling with constipation. And then they're on several medications with that side effect. And so we see a real struggle there. I used to welcome the prescriptions. They did help with my son's behaviors, but then we could tell after a while it wasn't the real answer. It was just suppressing a symptom. The behaviors were a symptom. And so I like to see the body properly supported, and so I always start with the gut.
Okay, great. And my first impression of this gathering was that we were going to kind of avoid some brand names and that sort of thing. But I think in terms of where we are right now, just get with the people that brought you here. We got some sort of very, very interesting gut solutions, and that's a start. But one of the other key ingredients, let's all get real logical here. Everybody needs to be drinking water, and you need to be drinking water about half your body weight in ounces. Just good common sense. Now let's jump to this idea of sleep. I want you all just to imagine what it's like if you miss a couple of hours of sleep. Well, let me go through this first piece. Did you know that if you miss 2 hours of sleep in one night, you lose 50% of your immune system for 3 days? So, Dr. Latella, do you see that sleep is a factor here, either for both the kids or the family? And then we'll talk about some issues and maybe how we can improve on those.
Oh, absolutely. If you aren't well rested or well hydrated or well nourished, but with the sleep, you're ragged. I mean, you're short tempered. You can't even be your best parent. The child isn't ready to go to school and learn. He's not in the mood to be social. And it's a myth that they don't want to be social. They do want to be social. But if you don't feel well and you're exhausted, and it's not just 2 hours of sleep a night, sometimes all they get is 2 hours of sleep a night, and they wake up multiple times, and sometimes they just stay up for 2 days. A lot of parents tell me. I just remember our family was really, really hit hard by the exhaustion. I couldn't kick a cold as fast. I mean, I was never getting sleep. One time when my baby was about 2.5 months old, he and my husband had both got a cold and kicked it, and I was still weeks later still struggling with double bronchitis. And my husband was a senior resident at the time and doing a lot of call at the hospital. And one night when he was on call, he just showed up at home and said, "I'll watch the baby, you get some sleep." And it was so odd. Years later, I said, "Why did you show up that night?" And he said, "I thought you were going to die from the lack of sleep. You just never got any sleep, and then you would get sick, and you couldn't, your immune system was down, you couldn't kick your colds. Your whole days were spent in a fog. It was hard to care for the baby." That sleep is everything. And it was really, really hard on me. This is a girl who likes to sleep. So I was
look at
grateful
those
when he
kids
started.
too, and we wonder why they have some kind of unusual behaviors. And there's going to be a portion of that we can change in our homes if we get those kids on set schedules. And we help to make sure that that environment in which they sleep is very, very well taken care of, because they're going to do nutsoid stuff just because you're not sleeping. If you don't believe me, try taking 7 days and not sleeping yourself and see what kind of pretty face you put on. It takes, like Zig Ziglar used to say, it'll lick all the red off your candy. So what we wanted to address next is the sense that, let's break into a little bit of how this new science of redox signaling, and there's only one place you can get it. All of you will figure that out. Where you can take this and ingest it. And one of the things, Doctor, that we were talking about previously was the body's master antioxidant. It's called glutathione. It's radically interesting that if you were to take the exciting glutathione, antioxidant. Let's get antioxidant. There's a lot of holes in the original theory by Melzack and Wall on antioxidants. And some of the things we need to know real quickly first is that, remember, we're talking about reducers and oxidizers. That's why it's called redox. An antioxidant can't work unless it's activated by a reducer. So you got to have them. They're part of the natural plan. And we're adding back, when we take this oral form, by putting that back into the system, you're putting in the reducers. And so now if you have antioxidants, they're going to work. Without it, they're not. The second piece is that the cells in your body will start making individual assessments of how they're doing. They now have better input of what's going on. And we're going to be talking about that in terms of the genetic turning on and what's happening too. But the cells in your body are reacting as best they can to the environment around them. In fact, many of the conditions that we see that show up where a kid's doing pretty well, and then all of a sudden one day things change radically, there's an environmental change, there's sort of a trigger. And we know that genetically, most, if not, I think I've heard it, 95% of genetic disorders don't have to happen unless there's a trigger, and the trigger will set that off. And that trigger is environmental. So that one of those major triggers could be sleep or an illness or puberty, change in environment, in emotion, nutrients, those kinds of things. So through that process, our best bet, the thing that was designed for us, is called glutathione. And it should be made in the cell for use by the cell, and is literally tens of millions of times more effective than something you can take from a plant on the outside. And what we know is that if you're using an antioxidant from a plant, interestingly, once it neutralizes a free radical or an oxidizer, it literally becomes a toxic material that has to be taken out of the body. But with the naturally occurring glutathione, you will, the glutathione can do millions and millions and millions of reductions, reducing the oxidizers, neutralizing them before they wear out. And then interestingly, when they're worn out, they combine with another worn out glutathione and they actually make you sleep. So it's a natural way for your body to go back to work and go to sleep. So these are environmental pieces that we can do to make some changes in kids. Now, theoretically, once you saw this study on introducing redox signaling to a group of 35-year-olds over an 8-week period, and we saw that there were 5 major overseer genes that began to turn on, become aware. Now, the whole idea there is that through Torre Laboratories determinations, about 31% increase. That was a sloping increase over time, average age 35. And we don't know what that slope was going to do afterwards, but it certainly didn't appear to be dropping off. It's just that it was a cutoff date of 8 weeks and 8 ounces a day. But as those turn on, you're better able to assess the environment around you. So if that's true, what caught your attention about using this in your plans as an author, as a person who treats kids with autism? Why did you think maybe there's some potential here in using these?
Well, the gene study is exactly what caught my attention. I, work with adults and children on the autism spectrum, and their research is revealing certain areas of health challenges that they have. And several of the pathways from the Torre gene study matched up with that. The people on the spectrum struggle with gastrointestinal dysfunction. They don't make enough digestive enzymes. They have inflammation and oxidative stress. They have immune dysfunction. And so all of those were, the pathways that this product addresses in the gene study. It really caught my attention because that's the whole goal of our support protocols. We're always looking to correct and support the immune system, to help the body with an appropriate response to inflammation and oxidative stress. Digestive enzymes, if there's something that can help the body make more of its own digestive enzymes, that's best case scenario. We want the body doing all this work. So that's really what made me sit up and take notice. The gene study shows that the pathways involved are digestion and digestive enzymes, inflammation, oxidative stress, the immune system, and it affected a couple more, but those matched up with what we're struggling with, to support in my office. So that's why I became interested in it.
Well, very good. And there's some really, really interesting stuff here, because remember we talked about triggers where maybe kids going along really well and then some trauma happens and then they're changed. I mean, it's very obvious. What are some of those traumas? And one of the things is that the world's throwing stuff at us all the time. We're in a very toxic environment. We have too much stress. We don't sleep enough. We're too dehydrated. We got poisons in the air, poisons in the water, radio waves, microwaves, light pollution, sound pollution, and you put them all together. And every industry will tell you, that one won't kill you. It's not so bad. We do studies, so we can still, work within our industry. But when you put them all together, that and the fact that we've made 100,000 chemicals over the last 100 years, and every one of them's carcinogenic, that didn't used to exist. Someone living 100 years ago would have gotten, we get more toxicity and stress from the environment in 15 minutes than they got in an entire lifetime 100 years ago. Mm-hmm. So how do we adapt? The adaptations occur in large measure because of this gene set. It's really interesting how this works. The genes have to be on guard. They have to be watching for changes in the environment. And then they have to be able to send signals to various places to react in ways that will help us adapt and change and guard ourselves from some of these negative changes. In this Torre study, the one thing that was really most interesting to me was that it was 5 genes that they were measuring that were having this acceleration. And each of those 5 genes would actually stimulate, turn on, or kind of enroll other genes in other areas. And so we get this vast landscape of observers that now can be aware of the environment and help you to control the environment before it overwhelms you. The other thing that's become very interesting is that when we give this system a boost, we can now interpret the environment in a way that asks the cells to create their best self, cells the way they used to make them, and to make the environment around the cells in your body in ways where it worked perfectly before. Especially in those trigger scenarios, let's set up the environment. The cells are going to be replacing themselves over time anyway. They all do. They make new fresh ones. But what if we had a way where they could refresh themselves with better information? They still have the same DNA they always had in terms of the sequencing. And now it could use that DNA and go back. It would make logical sense to repair the next time around, or to replace with a repaired system and work its way back out. These are really exciting things on the horizon. I'm going to bring up one other little piece from my physical therapy experience early on. One of the things we found with STEM behaviors, these repetitive, sometimes painful things that would, for each one of us, would be very difficult or painful. Wondered, what is it that causes that frustration level, if that's in fact what it is? Or what is the need for these kids to be doing some of these things that are really personally damaging? And we stumbled on something that's just interesting in clinical practice. Some were unable to really learn. We were trying to teach them things like, we'd have the teachers in there trying to teach them the alphabet and singing and that sort of thing, and it just wasn't getting there. It was as if, that's all fine, but right now I need to breathe. If I get that part done, maybe I can pay attention to it. We were so distracted. And so we did a really interesting kind of test with a few kids. Would this be with everybody? I don't know. I'm just throwing it out there for some of you just to be aware of. And one of them was to take kids and put them on a little plate that was hanging from a rope, and we'd spin them. You remember how little kids kind of like to go around in circles like that? All of us would go, here we go, it's too much, I can't do that. But it seemed that the noise, that the radical loud input to their nervous system had one common, really strong input. And at that point, they could relax and learn. And maybe they're trying to give themselves these really strong inputs, biting their hand and doing some flapping behaviors, and they look like things that I would do if I was frustrated. If everything, all my filters are gone and all this information's coming in. So that was really interesting to me. But then I found when I started using some of these with friends of mine who are adults, who had anxiety, they were just wound up tighter than a 7-day clock. One unfortunate incident was a grandparent who some people invaded the house through the window, grabbed him by the arm and pulled him out of bed, dislocated the shoulder on this side, and then took a baseball bat and commenced to knocking his head in. And he was in a coma for months. When he woke up, he had these repetitive behaviors. He was very fearful. It kind of makes logical sense, but he got such poor sleep because every hour he would get up and turn the lights on. Mm-hmm. And then he would open up every window and close every window and lock every window. And then he'd open up every door and lock every door. And then he'd fall asleep and do it over and over again. And introducing this sense of allowing the body to communicate with itself, just everything calmed down. So it made sense that perhaps we could try these in these areas. Well, I would like to do a kind of switch a little bit. There's some of the science that we wanted to throw out and give you a couple of experiences from families. And so, Janet, through the process of, how did your son turn out?
He's doing very well now. All the difficult behaviors went away once the body, it took years it's very complicated, all the different areas of health challenges they have. But over the years, he was able to calm down and be his best self. He is a very happy, extroverted bartender in Houston at the moment, working on his writing career. He's an Eagle Scout, a college grad. He drives a car, and he has a girlfriend of 3.5 years who's delightful, and they're talking about marriage. So.
Very good. Now, do you have
Yeah.
just sort of a gut level feeling that maybe if the communication had been clear, less confused, maybe those activities that you did that made a difference may have been perceived faster, learned faster, worked faster? And if that's true with maybe with the redox, if that's all we do is we just get clearer, more understandable signals, perhaps the other things that you do would work better. Kind of makes logical sense, doesn't it?
It does. From what I understand, the redox molecules help your body use other things you're doing. Like if you're giving supplements or things like that, your body's better able to allocate them where they need to go and make decisions regarding what you're already purchasing and putting into your body. So yeah, I wish I had known about it sooner.
Perfect. Okay, I'm going to open up Bill Peary now, and I want to introduce Bill Peary as one of the kindest people I know, but he also has a magnificent way of turning a phrase. And one of my favorite things I just learned this afternoon from him was we were trying to sort of butter the bread a little bit. That's one of the vernaculars of the old days, and try to get somebody get them an incentive to come and join us and be on the thing. And you know what he said to me? He said, let's just spread a little mayonnaise on it. Now, I don't know where you come from, but that one, I heard it. I got that. So Bill is a heck of a communicator. And also, could you take a couple of minutes as granddad and tell us what it was like going through your grandson Roman condition? Give ideas when things started, how much you used, what the results were. That's really in a capsule what we're looking for.
Well, sure, Jerry. The story starts about 3.5 years ago, and my only grandson, Roman, he and the mother, my daughter of Roman, they lived about six hours away. She's a single parent. She was a garment lightened, so she represented children. And being a single parent, and she had a huge caseload, obviously Roman had to go to daycare. And it wasn't long after daycare, they suggested Roman to get evaluated. And she did. And the pediatrician pretty much said they were pretty much right on that he had definitely some challenges. And so he actually became what I just found, I've learned that 1 in 59 children are diagnosed with this. And I'm knocking on the door at 60, and I just don't remember back in my younger days, maybe one person that had this challenge. And so I knew nothing about it, and I was very motivated to find more information about it. Now, on the other hand, my daughter, being in her position, had all the best care available, and got Roman into the therapies and everything, and wasn't getting better, but seemed like it was actually getting worse. Roman had 3 goals from the pediatrician. One was just to kiss fruit, because all he would eat would be chicken nuggets or drink milk. That's all he'd want to do as far as eating. And the other was to get into a car seat or a bathtub with any confrontation or maybe even a meltdown. And the other was just to make a noise with a car, because he had no imagination. Now, Roman could talk. In fact, it was hard when he was first diagnosed. It was really hard for me to believe that he was going to be diagnosed this, because I thought he was a genius. I mean, had a really fetish with letters. He could put letters together age 2 and actually have him spell out words, do his ABCs. So, you know, we just were blown away when the diagnosis came. And Emily actually had a client that was 13, was similar to Roman as far as his skill level at that point. But now at 13, he was still using the bathroom in his pants and maybe rubbing feces on the wall. So through my journey, I don't know if it was through luck, faith, or I think it was God sent. I was kind of put in place with several people. One of them was Dr. Samuelson. He's the guy who actually stabilized these redox signaling and a huge advocate of this. And I got to talk to him about a lot of different issues. And the other person was right in my back door was Dr. Lentula. And through talking to people, I was introduced to her, and she written this unbelievable book, The Unprescription for Autism. And actually going through it, I mean, after I started learning more and more about it, I thought his picture should be on the cover. I mean, she breaks it down very easy to understand. And so while I was actually learning this stuff and I was giving Emily this information, she was getting more and more overwhelmed. And in fact, things were getting worse and worse to the point where he was getting so frustrated for the communication piece at daycare, he was starting to hurt the children. And they told her that if he continued to do that, they would have to be removed. And I get a call, and she said, "Dad, they kicked Roman out of daycare." And she's 6 hours away, no help, no family. I said, "Look, I got this." So I went straight down there, just hopped in the car, went down there because she was going to have to try to find someone to take care of him at home. And I was bound and determined to put all this stuff I've learned and actually together. So I spent there about 3 or 4 days, brought him home for 3 weeks. And, you know how, your kids are, you tell them stuff and they kind of believe you, but she was just so overwhelmed. So I started on all these different things that Dr. Lentula used, and then what Dr. Samuelson was sharing with. You couldn't actually mix redox signaling with anything. You can't mix it with anything. So it's in a topical, so you can actually rub it. And Dr. Samuelson actually suggested that because he wouldn't drink it. And it took about every day. I thought, well, I'm gonna have to try to do something different. Now I was using the protocol, all the different things that she was suggested as well. And so it was about day 6 or day 7. I would get a syringe of the liquid, and I still rub it on, and I try to shoot some in his mouth. And he'd actually, when I'd bring the bottle out, he would get up off the couch and leave in the foyer. And so about day 6 or day 7, I believe, I said, I got to do something that's going to maybe capture this here. So I just kept going to him. I said, Roman, this granddaddy's messing. It's not so bad. And I'd shoot a little bit in my mouth in the syringe. And anyway, each day I would try to do that. But this particular day, he came walking up to me, and I go, he's going to let me give him some. And I shot a little bit in his mouth. And he goes, it's not so bad. Now, I know that doesn't sound like anything to you or maybe a lot of people, but that's the first time he ever said anything appropriate, and from there on, we just did that game, and would get him more and more each throughout the day. And when I brought Roman back 3 weeks later, I brought back a different child, and it was, and I think Emily recognized it a lot quicker than I did because, things are subtly changed, and she was definitely all on board with it. Now he's 5.5 now, and I just had him about a month ago for a couple of weeks, I mean, we're riding jet skis. He's teaching him how to swim. I mean, he FaceTimes. He talks to me. He still has these moments, obviously, but I mean, it's night and day when you can put a lot of things together. And then I think the redox signaling is kind of like the stone that sharpens everything. But it's like everything. It takes a lot to build anything. And what we have our hands on, and I'm just blessed to be know about this and to actually meet Dr. Lentula. And it's changed our life, you know, and everybody in it.
So he's a little guy who has really kind of taken his place, begin to start to be the kid that he needs to be, and for the family to be that way. And so congratulations. I'm going to introduce one other person tonight, and thank you, Bill, and that's Shannon. And Shannon has she's going to help to broaden our scope here a little bit. In what we were talking about this afternoon, she and I, was that although we have kids that have different behavior or problems that kind of working in their environment, it's not just a diagnosed category. There are kids that get all kinds of stuff. And so Shannon, can you share a couple of experiences that your kids had with this material? And then let's all just sort of open our minds. Imagine that you're like Shannon or any of these other families, and you're looking, and we're sharing, and we're bringing it out. So Shannon, let her rip.
Sure. And as I told you, mom mode. First, I want to say thank you to Bill for sharing that. As a fellow parent with a child or children with special needs, it's really so touching to hear that perspective. Both my children have a disorder that causes them to have seizures. And in addition to that, my son had a lot of struggles with being able to focus in school, sit still, he has very impulsive behaviors. And it was a really intense struggle with him starting school a couple of years ago, because he not only had this issue with not being able to sit, he was not sleeping well. So all these other things that people are sharing is great for me, because it's the first time I'm hearing some of what they were saying, but it was happening to me. And I, just like Bill's daughter, I'm a single parent, and I was going through having 2 children with various special needs and medical diagnoses and symptoms, both on medication. And really struggling, really having a tough time trying to get through the day half the time. I myself was working 3 part-time jobs after a divorce, and just trying to get back on my feet. And then I had kids with some pretty significant issues that were really affecting their learning. So I was not closed to medication, but when my son was 4 and a doctor said, look, he's got some pretty intense issues, he should be on meds, I was not ready for that yet. And then by the time he was 5, I was like, oh my God, maybe I really need to do this. And then that's when a friend who saw me struggling with just so much on my plate had talked to me about other options outside of medication, which I'm not close to, and both my children took it. And for their seizures, that's the first thing I went to. I tried essential oils and other alternatives, really didn't help too much. Medication helped for the most part with my son, but for my daughter, who was 2 at the time that she was diagnosed with her issue that was causing seizures, they just kept having to increase medication. So I want to thank the pharmacist we had on here, because I am very close with my pharmacist. She's fabulous, and she watched this struggle. I was coming to the pharmacy and eat every 2 months. It was an increase of medication for this tiny little girl who also had other autoimmune issues and other health challenges. But the fact that at 2.5, my daughter was having 6 to 21 seizures on her medication that kept increasing. It was just too much. And it got to a point where there was an issue where she would be having seizures and vomiting. And we went back to the hospital after just being there 2 months prior. And I couldn't do anymore. I couldn't watch her go through that anymore. And as a parent, when you're trying to do everything that the doctor's telling you, and I really was, but I couldn't watch the suffering of my child anymore. I was doing everything they told me to do, and they were kind of at a loss. I didn't mention this, but my daughter also was 75% speech delayed because of her other challenges and what was happening in her brain and what was and wasn't working. She had scar tissue all over the frontal lobe of her brain, both sides, no explanation for it. And while I was I'll be honest, I was extremely skeptical of an alternative. I said no to other options for multiple months, including redox molecules, which I had looked into, but I just, I wasn't interested, or I wasn't as aware of what it was doing until finally I got to a point of desperation. And when everything else wasn't seeming to work, I gave something else a try, because that's what you do as the parent. And while it did take a while for my son, it worked. Within like a month, I noticed some changes with his sleep, and by 6 weeks, some behavioral changes. With my daughter, Abigail, it took about 3.5 months for me to really see something significant. And from there, it was just some very profound changes. Her neurologist and I, before I tried some other, the redox molecules, we had the discussion. Do you think she's going to have useful language? What's her life going to be like? I had this 2.5-year-old that, wasn't responding to speech therapy an hour and a half a day, to signing, to singing. I was singing because it uses the other side of the brain that wasn't affected by her seizures. And then we walk in there 6 months later with this little girl that started to have some form of speech and acknowledgement of people around her, and her doctor was floored. And then just, I don't know. I don't want to take up all the time, and I'm not, I'm open to questions or however you want to guide this. But what I will say is now she's seizure free for 2.5 years. And now she's off her medicine as of January, and she's doing great.
Okay, so how old are your kids?
Right now, my daughter is 5.5 and my son is 7.5.
And how much are they taking, and in what method? We noticed with little Roman, he was rubbing it on his skin at first and then taking it internally. So how'd that go for you?
Sure. Ironically, it's called magic water in my house because, like little Roman, my son could not handle the taste. I had to bribe him. I'm a no juice mom. So I went out and bought apple juice finally. And I said, all right, you're going to drink this little bit, and I'll give you this little bit of apple juice. And that's how it went for a few weeks. And then one day he came up to me. He's like, oh, it's magic water, Mom. I don't taste it. And the taste went away. And then by the time my daughter started taking it, we did something called clink and drink, because she didn't want to take it. But when her brother took it, she was more likely to do it. So I would get them their little shot glasses. And that sounds silly when you're talking about children. But they would get their little drinks together. They'd clink it and they'd drink it. And that's what we did. And they did. I started with 1 ounce. And then now when we went through the medication withdrawal, when we weaned off of meds, I went up to 2.5 ounces twice a day. And now they're both taking about 1.5 ounces twice a day.
Super. Well, I want to thank everybody for being with us, and especially my panelists, for Shannon and Dr. Lintala and our pharmacist, Mr. Guerrera, and for Bill. All of us are in this journey together, and we talked today about kids. Kids are the super special part of all of us, and they're the ones that we can kind of grasp with our heart sometimes first. This particular material is world changing, and I really encourage all of you. It's safe beyond measure, and has been so. We can show you all the details. And we want to thank you for being here and being a part. So we're going to close out. We want to, again, give you a license to just try. Get some, work with your families, and see if this process of adding redox signaling, proper nutrition through some of the things that we were talking about and sleep and hydration and loving families, you know, all of it fits together. If we can't build a whole better world and do it one person at a time, adding people as we see them, being brave, go out and do it together. Let's go make a difference, and we'll see you the next time. Bye for now.